Welcome to the 2021 TPA Board of Directors Candidate Forum. The Texas Pharmacy Association Nominating Committee, chaired by immediate past President Raj Chadawa, selected this slate of candidates from the many nominees put forth by the membership. This forum is designed to help you learn about the candidates and what they hope to accomplish if elected to the TPA board, as well as their vision for the future of pharmacy in Texas. TPA members eligible to vote will receive their ballot via email on Thursday, August 5th, with the ballot staying open through Thursday, August 19th. Now, to meet our candidates. For President-elect, Adam Chesler.
My name is Adam Chesler. I am the Senior Vice President of Pharmacy Integration with Village MD, and I appreciate the opportunity to submit this video for the Board of Directors at the Texas Pharmacy Association. I'm currently the treasurer of the Texas Pharmacy Association as well. A little background on me: I did some time with Walgreens and Target. I worked in the pharmacy operations piece there, worked at the Pharmacy Technician Certification Board for Strategic Alliances, and in that role I met members of the pharmacy associations across the U.S. I worked in telepharmacy technology for a while, so I'm familiar with telepharmacy that expands access to pharmacist care. And before my current role, I worked in regulatory and legislative affairs to help drive innovation to improve access to pharmacist care. In my current role, I'm centered around collaborative practice agreements and utilizing those to continue to improve access to pharmacists. It's kind of been the goal of my whole career, is utilizing pharmacists to improve access to care while lowering overall healthcare costs, because we know if a pharmacist is a member of the healthcare team, it reduces costs, improves patient outcomes, and is overall great for the healthcare community. I'm interested in serving on the board of directors to continue to drive these initiatives. I really see the future of pharmacy as pharmacists being reimbursed for the services they do, and I kind of have taken it upon myself in my career to help drive this initiative and this message so patients and legislators and all healthcare providers can really see that pharmacists are critical members of the healthcare team, and they should start being paid for more than just the product. So as a board member, I would help continue to drive the utilization of technology and innovation to improve access to pharmacist care and increasing access to pharmacists on members of the healthcare team and get them recognized as providers. Thank you guys for your consideration, and have a great day.
For President-elect, Carter High.
Hello, my name is Carter High, and I'm running for TPA's President-elect position. For the past 17 years, I've been heavily involved in promoting our profession. Being involved in our profession is an honor and a privilege. Being a leader for me is about recognizing talent and then putting that talent in the right spot at the right time. Leadership is about focusing that talent and harnessing those unique abilities. I was once told by a wise man, past president of TPA, Joe Harmison, that life is all about timing. The time is now that we continue to come together under one flag, one banner, one direction, one pharmacy. We've started that march towards unity. We need to continue that, and we've come a long way. We are stronger together as a cohesive group with a collective, strong, decisive direction. I want to be the next president-elect of TPA, not for respect, not for recognition, but for the continuation of a journey that was started long ago. My time and our time for our next adventure is now. I would like your vote for me as the next president-elect of the Texas Pharmacy Association. Thank you.
For Treasurer-elect, Lisa Killam-Worrell.
Hello, my name is Lisa Killam-Worrell. I currently work for the University of North Texas College of Pharmacy as an associate professor and associate dean for the pharmacy curriculum. I'm also a volunteer pharmacist at the Mercy Clinic, which serves the underserved, non-Medicaid, non-Medicare eligible patients in Fort Worth. I have experience in hospital pharmacy, clinic pharmacy, retail pharmacy, and in academia. Treasurer-elect, I would like to work more to keep Texas Pharmacy Association on a good financial trajectory towards solvency, and really understand how our finances can work with our initiatives going forward. And what I see for the future of Texas pharmacy is that pharmacists and the pharmacy and the technicians are no longer a place where patients just go quickly, pick something up, and leave, or drive through. The pharmacy, the pharmacist, the technician are all places where patients feel comfortable receiving care. They get information about their disease states. They get information about their medications. They have their medications optimized by pharmacists. In addition, they learn more about how to prevent health problems, side effects of medications, and live healthier, better lives. So thank you very much for your time.
For Treasurer-elect, Chantel Parker.
Hello, my name is Chantel Parker, and I'm a healthcare specialty supervisor from Houston, Texas. On a daily basis, I work to support pharmacists by developing growth strategy, cultivating execution, and driving sustainable results. I am fully dedicated to advancing the profession of pharmacy and elevating the women within it. I believe that collaboration, establishing positive relationships, and leveraging influence are the keys to success we need to push past historical barriers, make pharmacists' voices heard, and ensure that pharmacists and technicians continue to have a seat at the table. Considering the current socio-political climate, championing health equity, access, and ultimately health outcomes for marginalized communities is what I consider my life's work. COVID-19 vaccination and testing are only two of the ways we stepped up over the last 15 months. While we are often left out of the conversation, we remain the most accessible healthcare professional as provider offices were shuttered and telehealth became the only option. Across Texas, our technicians have stepped up in unprecedented ways and are practicing at the top of their licenses. With the current momentum coming out of the legislative session, the unique position we are in as we have proven our worth as a provider throughout the pandemic, and the sheer amount of support and interest we have, we must turn our collective efforts and focus to strengthening our impact with more members, more dollars, and forcing implementation for the legislative wins. What will be our battle cry? Our profession doesn't have to hang in the balance. It's up to us. TPA, I am your candidate for Treasurer-elect, Chantel Parker. Thank you.
For Director, Position 1, Leanne Hampton.
Hello, I'm Leanne Hampton. I'm a pharmacist owner of Paris Apothecary. I work in beautiful Paris, Texas, home of the only Eiffel Tower with a cowboy hat. I graduated from Texas Tech School of Pharmacy in 2002 with a PharmD. I've worked in a pharmacy since I was 16, starting at a local Eckerd. I did a rural pharmacy rotation with Mr. James Myers, past TPA president, and my love of independent pharmacy bloomed. I love being a community pharmacist and having relationships with my patients and being involved in direct care. I enjoy staying ahead of trends in our profession. Independents tend to be pioneers. I'm proud to say that I was the first in my area to do immunizations and point-of-care testing. Currently, we're the only ones in our area able to provide healthcare workers and the community with hand sanitizer. I would like to serve on the TPA Board of Directors to continue to push my profession forward. Pharmacists are vital to healthcare. As a Board of Directors serving with other pioneer leaders, we can accomplish so much. The pharmacist profession has been so splintered into categories my whole career. As of late, we've made much progress in uniting our profession, and I would like to help that continue. Unification is vital to our fight to save our profession from PBM abuse. PBM abuse affects all community pharmacies and other pharmacies as well. We have to free ourselves from their tyranny so that we can offer more services and serve our patients in more unique, progressive ways. So my goals, if elected a TPA board director, would be PBM reform and enhanced services. My vision of the future of pharmacy is that community pharmacies would be mini urgent care community centers. Patients could utilize pharmacists for an affordable healthcare experience. Have poison ivy? Go see your local pharmacist and get a cortisone shot. Not quite bad enough for a cortisone shot? Then the pharmacist can give you by a pharmacist script triamcinolone cream. For us to run these easy, low-stress, high-job satisfaction clinics and provide more patient care, pharmacists must be united. So in the future, I hope to see the continuation of mediation and for all pharmacists and personnel to realize that we're all in this together. Thank you.
For Director, Position 1, Lauren Corrales.
Hi, I'm Dr. Lauren Corrales. I'm originally from Austin, Texas, currently in San Antonio. I've worked for Carvajal Pharmacy since 2012 and am now a pharmacist at our long-term care pharmacy. I am also serving as our program coordinator for the ADCES accredited diabetes education program. I'm president of our local Bexar County Pharmacy organization and also a member of the TPA House of Delegates. I look forward to using my leadership experience to continue advocating for our profession. One of my goals is to increase TPA membership. The more pharmacists we have advocating for our profession, the better. Especially right now, it's a really exciting time for pharmacy with everything going on in legislature. So I look forward to using this momentum to continue advocating for our profession. Another one of my goals is to raise funds for TPA. We are going up against these PBMs with ridiculous amounts of money, so every penny counts, and I'd like to take advantage of any fundraising opportunity that we can. And finally, reaching out to our pharmacy members. So reaching out to our local pharmacy organizations, making sure that their members are also involved at the state level and advocating for our profession, and also reaching out to our future pharmacists. So reaching out to the schools, making sure the students are aware of what resources are available to them and how important it is to advocate for our profession. Encourage them to reach out to their local state representatives, not only now, but also when they graduate. I think we need to stress the importance of staying involved with TPA and continuing to advocate for our profession. We have to remember we're not just fighting for pharmacy, we're fighting for our patients. Our patients deserve the right to choose where they want to fill their prescription. Our patients deserve the right to access affordable, quality, accessible healthcare that pharmacies can provide. We just have to continue advocating. I think it's really important that the patient sees us pharmacists as someone more than just someone that's behind the counter, but someone that's fighting for them, that's someone that's advocating for them to get them the best quality healthcare that they deserve. I'm Dr. Lauren Corrales, and I hope I can count on your vote for a member of the TPA Board of Directors. Thank you.
For the Director, Position 2, Ranan Ching.
Hi, fellow TPA members. My name is Ranan Ching, and I'm asking for your support and vote for the TPA Board of Director position number 2. I'm an independent pharmacist here in Austin, Texas as the PIC of Tarrytown Pharmacy, and I'm also currently on the TPA board in my final year as the Speaker of the House of Delegates. In my past 2 years of service on the board, I've been blessed to work with so many motivated, passionate, and dedicated TPA members. And during this time, I've had the opportunity to advocate for the profession by testifying numerous times at the Capitol. I've been able to participate in all the Association Affair, Public Policy, and Financial Affairs Committee meetings. And I have a strong belief in the great impact that our association, pharmacists, and technicians can have here in the great state of Texas. It would be an honor to continue to be able to serve you, the organization, and the profession as a director of the board. I care deeply about our profession in all the different facets and practice areas, and I wish to equip, encourage, and help all of our members to positively mold the future of pharmacy. If elected to serve as a director of the board, I will promote and advocate for the profession of pharmacy as a crucial part of the healthcare system and community. I will encourage and empower other members of our profession to join TPA and our mission to advance together. And we'll also engage in meaningful dialogue and collaboration to make Texas a national leader of pharmacy practice. I'm so excited to run for the director position and would love to have your support as we continue to advance the profession together. Thank you.
For Director, Position 2, Sean Ahmad.
Hi, my name is Sean Ahmad, and I'm running for a director position on the TPA board. I am excited and humbled for this opportunity to serve the association. I've been passionate about and active in TPA since my P1 year at the University of Houston. During my final year, I was elected to be chair of the Academy of Student Pharmacists, where I worked with the TPA board, staff, and other student leaders to help create and implement the TPA ASP Cup and Sparks programs, both with the goal to educate and engage students to be active in advocacy and unifying our profession. Since graduation, I've served on several TPA councils and the Texas Pharmacy Foundation Board of Trustees, including their scholarship committee. I also have experience working in both chain and independent pharmacies. I'm currently PIC of Renew RX located in San Antonio, where I work in a primary care clinic directly with other healthcare professionals on a daily basis. As director, I will continue to fight for important pharmacy issues and build upon recent legislative successes. I will also focus on membership. I believe that there are far too many pharmacists who are unaware how PBM reform and other important pharmacy issues directly impact them and our profession as a whole. I want to work with you, the members, and also the board to find ways to engage these pharmacists. Through informal surveys I've done on my own, I believe that one example would be to use social media to capture the attention of these pharmacists with catchy headlines that tell them how these issues directly impact their career options and ultimately their salary. I also want to show students and new practitioners and any other interested pharmacists how they can use TPA to network and build strong connections across the state. I believe that this will not only strengthen the individual students and pharmacists participating, but also our association as a whole, as we're able to connect and build a strong bond throughout Texas. Once again, my name is Sean Ahmad, and I'm running for a director position on the TPA board. I ask for your vote so that together we can not only strengthen our profession, but also our association here in Texas. Thank you.
For Speaker-elect of the House of Delegates, Jason Davis.
I am a 26-year retail pharmacist. I've worked for both Walgreens and now HEB. With Walgreens, I was there for 22 years in various roles. And currently at HEB, I'm the manager for pharmacy compliance and regulatory affairs. So why do I want to serve on the board, and what do I hope to accomplish? So in my role, I've been far more involved in TPA since I took this role on with HEB. I meet frequently with the board members, and I know that HEB has a kind of a natural relationship with TPA. We're very supportive of our partners being a part of TPA. I know we've had board members currently and in the past on TPA. So I think HEB, it's a great opportunity for me to bring my perspective to the board, my experience, and obviously my passion for pharmacy and just get more involved. This is a great organization. It's an organization that I believe really stands for what pharmacy wants and brings together all the various groups. And it's been really nice to see that over the last couple of years. And I'd just like to be a bigger part of the organization. It also helps that in my current role, I have a lot of the flexibility, and I'm often in the up in Austin and able to attend these events and different things that need to be done as part of this role. As far as what I would like to accomplish, I think it's pretty simple. We want to continue to advance the profession of pharmacy. This is something that we have seen in this last 12 to 14 months with the pandemic, just how quickly we can advance our profession when given the opportunity. I think it's important, and the role with TPA to push forward and advance things like test and treat and expansion of immunizations is definitely a big part of what TPA does. And I'd love to continue that work and help to be a part of it. As far as the future of pharmacy, I think, the future is now. We're seeing that with this pandemic, just how much we can contribute. And I think it's very important that we continue to advance the role of the pharmacist, expand the role of the pharmacist, and at the same time protect ourselves, our profession and our businesses from things like the DIR fees, PBMs, and some of the pricing issues with UNC. I think we really have to continue to watch our back on those kind of things as well.
For Speaker-elect of the House of Delegates, Ashley Garling.
My name is Dr. Ashley Garling with the University of Texas at Austin College of Pharmacy. Currently, my role at the College of Pharmacy is Clinical Assistant Professor. I have been involved in the pharmacy world for the last 20 years. I have been in roles from community pharmacist to inpatient to oncology, corporate community pharmacy, and now I serve as the healthcare communications expert for the College of Pharmacy at the University of Texas. With this varied background, that gives me the ability to really see many perspectives in pharmacy. I also wish to aid those perspectives and those voices, and to become an asset not only to our Texas pharmacists, but also to our Texas Pharmacist Association. The COVID-19 pandemic has really shown the broad capabilities of pharmacists and showed that we are an integral part of healthcare. This has been shown not only in the state of Texas, but really across the world. And so if there is a time to be active in our Texas Pharmacist Association, that time is now. With the positive light that's been shown on our profession, we are in a prime position to really make positive changes, expand our scope of practice, and have more influence on issues that are important to pharmacy. Anything from reimbursement to immunization expansion, technician roles, test and treat, PBM reform, and many, many more. So as we're entering into this era of change and growth, I wish to serve as the voice, a voice of Texas pharmacists, as an advocate for Texas pharmacists, but also to always keep in mind protecting my fellow pharmacists in the state of Texas. We should protect our pharmacists, improve work environments, ensure they have the support that they need to expand our scope of practice, protect their mental and physical health, and improve the overall well-being of Texas pharmacists. The time to activate change is now. The time to educate the public on the benefits that pharmacists give to the healthcare profession and the healthcare in the world is now.
To learn more about these candidates, please visit texaspharmacy.org/candidates.